Well, aloha and good morning. It's good to see all of you here on a Tuesday morning for the COVID-19 care conversation here on the platform of the Honolulu Star-Advertiser Facebook page, where we are once again bringing you all the information and connecting you with some of our state leaders as we sort of navigate through this COVID-19 pandemic together. I'm Ryan Kalesuji, joined by Yunji Denise, and today we have once again Director Scott Murakami from the Department of Labor and Industrial Relations joining us. And he's a very popular guest. We know a lot of people already typing in some of their questions. Great to see people chiming in from Las Vegas, as well as those of you from Seattle as well. So not only people here in Hawaii tuning in, but people from all over the country, which we like to see. But again, Yunji, should be another good conversation with Director Murakami.
Yeah, he is always a very popular guest, and we know that the questions are already coming in. Nani has one, and we're going to get to as many of those as possible. Ryan and I actually did go through the past shows and looked at all the comments. We've also been in touch with the folks at the paper who operate, Christine, who does the Kokua line. So we looked at those questions as well. So we tried to sort of condense them all into questions that would be applicable to a wide range of people. So we're going to try to ask as many as we can. We do have limited time with him. We always like to start with the numbers, and we should say, first of all, that this is a conversation brought to you by the Hawaii Executive Collaborative, which is a consortium of business leaders and civic leaders in Hawaii working to make it a better place, along with Hawaii Pacific Health. So we thank them for their efforts to help continue this conversation. We always like to start, Ryan, with the numbers and more good news.
That's right. Only one new case reported yesterday. So a total of 621 positive cases throughout the state. The death count for COVID-19 related deaths are still at 17. The good news, again, it's in single digits Hawaii has been in single digits for the past 16 days. And the total number of recovered patients have been 548. So 88% of those who have been infected are now classified as recovered. So again, we're seeing progress every day, which is a great number.
Yeah, wonderful to see that. And along with that announcement, as we start to flatten and actually trend downward with the curve, was UH President David Lassner yesterday announcing that the University of Hawaii will return to classroom learning in the fall. It sounds like they're going to be doing some kind of a hybrid with some distance learning and some in-person learning. They're going to be implementing social distancing in the lecture halls. It'll be really interesting to hear how they plan to actually do this. And we are going to get to talk to him right here. He is joining us. He's confirmed to be our guest on Friday. So any of you who want to learn more about what the university is doing, and it's not just UH, we understand that Hawaii Pacific University and Chaminade will also be coming back in the fall. And, I'm sure they're all learning best practices from each other.
Yeah, it's going to be great to get an update from him. I know there's a lot of people also wondering about how athletics might proceed. So that's another question that we can ask him. So I think it'll be a great conversation. Someone else who is, of course, a popular person is Director Scott Murakami, who joins us now live here from his office. Good morning, Director. First, if we can get an update with you, because we know that yesterday there was a lot of claims that actually went through. So if you can maybe provide an update as of today.
So yesterday, the report that we had was we paid just under $46 million to claimants. So, and we do know that we've implemented some new technology that allows people to file their sort of certifications in a more timely way. We understand that they were having some problems with that, and the solution that we implemented actually replaces in large part the existing portal that we had that was based off of 10-year-old technology. So the new portal, the way it works is it resides off of a SQL API gateway, and that gateway feeds into a replicated SQL database of the systems that we have. So basically then, people can certify through this new portal or this new gateway, and the data in the replicated database synchronizes with our mainframe. And what that allows us to do is control the traffic more effectively and allow more people to certify. So this new system was launched on Saturday afternoon, this past Saturday. On Sunday, we'd normally take on average about 20,000 claims. We took just under 40,000 claims, so it doubled in capacity. certifications, certifications. So we know that the technology works. We had to bring it down for a little while yesterday, but it is up and available today. So claimants should have an easier time certifying. And we do know that was a concern for people, even calling into our call centers. And thanks to yourselves and other media outlets who have shared that with us. So that was a solution that we implemented just on Saturday.
So with that new system, at what level are you? I think the last time you were here, about 30% of eligible, I think it was 36%, if I remember correctly, of eligible claims had been paid. Where are you now with those numbers?
So right now, I guess the best way to look at it is the total number of claims that we've processed first. I think I'm going to try to report it out that way. So we have received a total of 222,545 claims. Of that, we have processed 60%, or 132,472 claims. So those are the claims that are completed. They've been decided on, and we've either paid or they've been denied. Of the number of claims that have been processed, 70% have been paid out. And that number comes out to 93,168 claimants. So there are a lot of people that we paid. We still have 90,073 claimants that we're working on at the convention center. And those clearly are the individuals who are calling up and have concerns that we are also concerned about.
I want to get to some of the questions.
They've made a big, that's a big jump though. I mean, that's a lot of progress.
It has been. And, and I'm very proud of the team for doing that, and certainly something that we recognize will provide relief for people. But quite honestly, I'm still worried about the 90,000 people that we have in the queue that we're working on.
I want to get to some of these questions already that are coming in. One of them from Genevieve asking if their employer got the PPP loan, do they still need to file weekly? How does that adjustment made now with those employers that maybe might be bringing employees back, or they were unemployed and now they're being back in because of PPP? How do they navigate that?
So Genevieve, that's a great question. In the past, people have asked us, wouldn't it just be possible to remove the weekly certification? And the reason we couldn't do that is precisely for the reason that Genevieve has brought up. Those individuals who have been offered work need to return to work. And if they choose not to, that actually disqualifies them from their UI benefit. So the period of time that you were separated from work, and when you're called back to work, we will cover with the UI benefit. But once you're offered the opportunity to return to work, you need to do so. And that comes to us from the employers through the weekly certification.
On that weekly certification issue, there was a call that came into the Kokua line asking, what if your department can't reach a business owner or operator to verify that a person's employment has in fact been separated because the business is closed? How are you navigating that?
So we actually have a separate portal, our tax portal and our business, contributions portal. And that portal is where we get employer information and notify us on the status of employees. We are also looking at standing up a separate database that that allows employers to log in and verify through their normal authentication process, but then uploads the data and they have access to a database and can tell us, hey, I've offered this employee employment on this date, and the individual hasn't returned. So what that does, it helps us identify a particular situation where we would have to then, look into whether or not the person actually should be returning to work. And at that point, what we would do is we would have to stop the benefit for the individual, and the individual would have a right to appeal.
Okay, great. Another question. Again, we're pulling questions that also have come in, not only the ones that are coming in today, but one of the questions that we couldn't get to last time was from Susan. And she said, how long after you lost your job do you have to file, or how long can you wait to file, basically?
Okay, so Susan, first, I'm sorry about losing your job, but you don't have to wait. There used to be a 1 week waiting period, but in the governor's initial proclamation, his first proclamation, he removed the 1 week waiting period, so you don't have to wait. You can file as soon as you've lost your job.
And then after you've lost your job, how long do you have until, the benefits may or may not be there?
So what I'm going to ask them to do, first of all, is make sure that when you file your claim, you file it as accurately as possible. The common mistakes that people have on filing, we're finding, is that they'll have the wrong routing code on their application. They may have the incorrect bank account information on it, or they have the wrong business name. And a lot of times it could be because they either worked for a employment agency, and so they will list the wrong business down, or the business is doing business as a DBA. So you need to be careful of those three things. But if you get your, assuming you have a clean claim and it's all of the information is correct, it'll process within 15 days.
Okay. You know, one of the problems, again, we are seeing some of the comments that are coming in, seems to be the busy phone lines.
Yeah.
Is there any way to add more support to people taking calls to address some of the problems and to cut back some of those busy phone lines that you're getting? Is there any way to add capacity, basically?
Yeah.
Because it seems that a lot of people are trying to call and they may have specific questions about it, because we know that this is the process to fill this out. It's some pretty specific information that you need, and some people just may have questions about that. Can capacity be added to those phone lines?
Sure. So right now, part of the challenges that we had were that the systems have to be the phone system had to be associated with a terminal and a connection to the mainframe. But we are looking at ways of using a cloud solution that could do that. In fact, that's where I was just before this. We were on a phone call with Amazon and Rhode Island to listen to how they deployed their solution, because ours is not a cloud-based solution yet, and it still runs into some challenges with the existing infrastructure in the state. So I am looking at another web-based or cloud-based solution that would allow us to scale it much more effectively. And the reason I'm worried about this is because once we start opening up the economy, once we start getting back to business as normal, I'm going to lose a lot of the volunteers that are in the call center. So if I can get them back at their desks, having them doing the claims data for us, then most certainly we'd be able to solve that situation. So right now, the plan is at some point to at least to apply a cloud-based solution, but I got to make sure it's the best solution for all of us.
Lisa has a question, and it echoes something that other people have asked too. It says, when checking the status of a claim, it says first claim paid. What does that mean? Obviously, she's not seeing money in her bank account yet. So what does that actually mean?
So, Lisa, I believe it means that your claim has actually been processed. Your initial claim has been processed. You're qualified for your payment. You have to make sure you certify, of course, and that was the challenge that people were having. So what I'm going to ask you to do is try it now, because again, we did have to take it down last night, but the server came back up. This new SQL Portal and server came up about 8 o'clock this morning. So if you wouldn't mind trying it, make sure you can certify, and then that'll make sure that you get paid.
The other question that we're having is with emails and email responses.
Yeah.
I know that you gave us some specific emails for specific problems. Has there been any update to that, or what is the best mechanism for people to, if they want to contact or email, is there a listing of specific emails, or where should they be going to send those questions in?
So we do have people running down the emails, but they're just really a lot of it. So what we're trying to do is get through all the backlog, and the areas that we're experiencing challenges in are the two areas that you, there are three areas. One was the ability to do the certification. The other one was in the phones, and the third was in the emails. So we believe that the certification issue has been addressed. I'm sorry that we can't do that 24/7 yet, but we are looking at ways in which we can do that. But at least we have greater throughput now, and we know that the CCs, actually people have an easier time logging on. The second thing has been the phone system that we talked about. The third thing is the emails. So we did deploy more staff to actually address these emails. People are sending in a lot of messages because they didn't get their first one answered. So we are we do have about, I think it's 10 more personnel that are trying to get through all of the emails and answering questions for people. But there are a significant number, especially for the disqualified emails. And a lot of disqualified emails are the ones that will go through the PUA system.
Let's talk about that, shifting gears. Last week you said that it was going to be up, and now it is. So I know that a lot of people have been registering. That money is still not in process at all, right? We're looking at, I believe you said 2 weeks of just basically, is it pre-qualifying or registering? Can you explain that part of the process?
Yeah. So the the project plan that was laid out was that 15 days after the hard launch of the front end tool, or the application receipts portion of the tool, the back end would be completed. So the team is working on developing that back end with their contractor. I will tell you that last week, Wednesday, we're looking at having actually another department help us with the pool program. And the reason for that is that we just don't have enough resources in the Department of Labor and Industrial Relations. When this problem first started up back in March, we already redeployed about 76 staff members from within our department, and then that number has subsequently grown quite a bit. So we just don't have enough resources to manage both programs. So I don't want to say too much about that, but there's actually another state department that will be helping us with the management and rollout of the pool, and actually the oversight of the pool program.
Are you still anticipating that 15 days, that you'll meet that 15-day benchmark?
Yes, I am, because they're using the same vendor. So the actual process, I don't think, has changed in any way. It just ensures that we have greater resources doing the eligibility assessments, all of the validation issues that we need to, and make sure that the data is much more available. So I don't think it's going to cause a delay. At least we're not planning for that. But, at this point, I don't want to promise anything, because this is such a fluid situation that, and again, PUA is a program that we never had before. It's not like the unemployment insurance program. It's actually it's a public assistance program, and it's not an insurance program. So it's very different from what we're running with the UI program.
Again, taking another question that we had last week, this one from Beth. She's saying, if you had a reduction in pay, and we understand that you can file for unemployment benefits, but is there a minimum requirement on what your income level is after the reduction in pay that will qualify you for this unemployment benefit? So maybe they just got a 10% pay, but they might be of a higher still pay grade. Like, is there a certain minimum amount that they are required to meet in order to qualify?
That's a tough one, and the reason is everybody's paid different amounts. What I can tell you is that somebody in that situation should file with us. And what will happen is we'll do our due diligence in our assessment of their claim. And in doing that, we'll then be able to determine what the claimant would be entitled to. Now, if the pay reduction that they received is large enough where the weekly benefit that they'd be entitled to exceeds the amount of the loss that they have, then they would be receiving a benefit. But it's hard to say, to give people a specific amount of what that is, because it really depends on, number one, how much they are paid, what their weekly benefit is, and then also how big of a pay cut that was.
Okay, PEK Boyd has a question, and I know you've talked about it before, but just want to clarify for the neighbor island, should they be calling the county office or Honolulu? They can call either their neighbor island, and they can actually call any state UI office or the toll-free number that we have, and we'll be able to help you, because on Oahu we're processing it at the convention center, as well as with the phone centers. We are taking calls from everyone. Okay, I want to get to Jean Marie, because she's been asking this question again and again. So obviously she really wants it answered. She wants to know this about PUA. Self-employed workers, this is a quote here, who states make an agreement with the Department of Labor will receive pandemic unemployment assistance, which is PUA, based on their recent earnings, and also was able to receive the $600 a week on top of that. Yes. States will be reimbursed. What's Hawaii's status with the program that she's talking about?
So that's the pool program that we talked about before. So it is in process, and they're right. Whatever the claimant's right, whatever amount that they get is just a portion of it. And then on top of that, they get the $600 plus up. So the first one is determining what the claimant actually should receive. And then they would, on top of that, get a $600 plus up. Now, those funds are completely federally funded. We have entered into the agreement with the U.S. Department of Labor. So it's now in the phase of building that back end that we were talking about.
As we do start to go back to work, as you know, different departments, as you referenced, start to go back, I wonder, what is your department's timeline for going back? Because there are many people, I'm sure, who perhaps don't have computer or internet access. They might be disabled. They might, you know, speak English as a second language and not able to fill out the form. I know you've done some work to try to make you know, people who speak other languages have support. But
Right.
what do you think is the timeline for your department actually taking in-person appointments so that people can actually go down there? I know that if you open tomorrow, social distancing would be pretty difficult.
Right. Yeah. And I think it's a balance of all of those things, right? Because I think as much as we can, we know there are about 6,000 additional claimants that we have out there that are yet to work on with the filings. The trick really is for us, if we can ingest the filings and get all of those squared away, then I think we'd have an easier time opening up, because then we can manage the claims within the system. The contact with the community really is with the initial filing. Once the filing is in, right, the rest of it we can manage by phone and whatnot. It was just a matter for us to run down the larger issues of claims that were in process. And now that we're at the 60% mark of process of all of the claims that have been processed, so I think that it'll get to a much more manageable level. But really, it becomes a situation where, can we ensure the social distancing? Can we abide by all of the requisite city and state governance issues that we have to? And then make sure that from there, we have a mechanism to supporting the community and the public within in-person types of filings. And so the way to do that is to make sure that we take care of all of the filings and get them in.
So if last week you were around 36% and now you're at around 60%, when do you anticipate, you know, getting over the threshold of, you know, let's say 90%?
Right. So I'm thinking that this is going to be a pretty big week for us. And the reason for that is we are looking at implementing an automated way of kind of clearing out some of the some of the higher level issues that we've been challenged to work on. So there really are higher level issues that have to be adjudicated or assessed by an claims examiner. And these can involve things like, why was the individual separated from work? Is it truly a voluntary or involuntary separation? And that takes a little back and forth. There are other issues around there that or surrounding those questions that I can clear out. And my feeling is, if I can eliminate a lot of those other types of less significant issues that don't require specific adjudication, then I can really focus on the cases that we need to. So we are looking at implementing, and again, I try not to promise things that we can't deliver, but our target rollout for that is actually on Wednesday. So we're going to do some testing tonight as to whether or not I can remove those issues, and then start removing the issues on an automated level. We still needed to have the volunteers in the convention center. I want to make that really clear, because what we're doing is they were looking at specific issues between whether or not the employer matched up with the claimant, making sure the data separation was accurate. So those are things that I cannot just simply erase from the system. But what I'm looking at now is, because we've gone through the bulk of that and we're now at the higher level issues and we know what those issues are, can I just look at them from a blanket perspective and say, you know, these are really sensibly related to COVID-19. And if that's the case, I'm going to release it. And if I release it, that then, you know, I have to deal with an issue about materiality, right? What is the actual material of impact of this? But it lets me do it in a more system-based way, a systematic way, and releases a lot of the issues that we have, leaving me with the ones that I truly have to adjudicate.
John Ark has a question. We get this question every week, but Ryan, I don't know if you can grab that one to call that one up. He says, please clarify if our unemployment benefits will be retroactive to our date of layoff.
Yes, it will be. John, I can assure you that all of your claims will be paid. Once you get in certified, you can backdate them. You can do all of the requisite certifications from the date of the time that you've been separated from duty, and you'll get paid up to the point in which, of course, your benefit would terminate with your return to work.
Another question that came up, and I can't find it right now, but it was a question about those that maybe had, and we talked to the governor, he's saying that this is one of the issues, is that there was a mistake in the claim and they have to fix it. How would you best recommend people go back and fix some of the claims and the mistakes that they may have made in the process that might be holding them up from getting and receiving these benefits?
Yeah, once it's in our system, that's when it requires a lot of manual data entry and a lot of repair, and we have to actually look at the claim. The system does. The only thing I can suggest is that they take their time in filing their claim, because in filing your claim, if it goes through clean and all of the information is there, then you're going to be okay with processing in 15 days. Once it has the incorrect information, that's when we have to manually go in with the staff that we have in the convention center, match up the requisite data in the first place, which is the first phase that they go through. We call it the level 2 problem. But at that point, they start clearing out your some of the basic issues that you have. And then if it's a simple one, if it's a simple issue, like the employer was wrong, the date of separation may be different from what the employer reports, then it'll go through and get paid. But there could be higher level issues where the individual's reason for separation is different from that of the employer, and at that point it goes to a higher level that requires some adjudication and decision making as to what really happened, because after that decision is appealable by both the claimant and the business.
So at this point, if they do receive that error, they just basically have to wait. If there was a mistake made, they have to wait for the department or someone to reach out to them.
Right. And when I checked with our staff on what the status is of what's going on in the convention center, right, the level 2 issues, the ones that are simple are coming through, are they're out by about, I think, less than a week. So we know that we're caught up at that level. So my suspicion is that the hang up is either where people may have filed incorrectly and we're trying to get back to you, because there is about, like I said, 6,000 people in that population. But the other areas, if they've had a higher claims adjudication issue that we have to deal with now. And that's why, if I can, again, implement an automated solution that washes out a lot of those issues, just given the nature of COVID-19 and assessing how can I address that in a more practical, timely way for the claimants, it'll help to alleviate that.
Tessie has a question. Please tell me if I qualify for PUA if my previous claim has been exhausted. I mean, these are two separate systems. Is that correct?
That's correct. And if your claim has been exhausted, what it implies is that you qualified under the existing unemployment insurance program. And if that's the case, then you may be subject to, depending when the separation happened, you may be subject to the other portion of the CARES Act, which was the 13-week extension period. So that is a solution that we're trying to get up in the middle of May. I'm still trying to do that, but we've had to actually retask some of our personnel to focus on the SQL solution that we ran up. But I can assure you that we're still working on the 13-week extension. And if the person qualifies, then of course they would be getting the additional 13 weeks of benefit.
I wonder how you are sort of taking, as you determine whether someone actually separated from their employment due to COVID, the employer could say, this person is essential, let's say a grocery store worker or someone who works in a coffee shop, right? And they're still allowed to be open. So, but the employee says, well, I separated because of COVID because I don't feel safe.
Right.
So how do you make that kind of a call?
Those are actually the real decisions that our staff have to face, and it's not an easy decision because we feel both for the claimant as well as for the business. But at that point, if they've been offered work and they've denied it, we have no choice, but we would have to terminate the claim, and the claimant then at that point would have a right to appeal. But part of it is it all ties together, right? Because if the business actually is a recipient of the PPP program, then they need to bring their people back to work. And if they don't, then they won't be able to convert those loans into a grant, which causes further financial harm to the state and to everybody. So, the only thing we can do in contributing to that timely is making sure that we pay the right amount of benefit in our insurance program. And that's always been a challenge because I shouldn't say always been a challenge, but I should say is that's fundamentally one of the challenges that we've had to deal with. I know the public and a lot of people were hurting, and believe me, I wanted to just pay benefits, right? But it's not a public assistance program. It's not a public aid program. It is truly an insurance program. And because of that, I have this fiduciary responsibility that our employees have to work to. And otherwise, there are longer-term financial impacts on both the Hawaii's businesses and most definitely the economic recovery of our state.
Okay, we have just a few more minutes. I want to kind of just try to do, I don't know if we can do this like a lightning round, just a quick response so we can get some answers as quickly as you can. We'll try to get maybe like 2 or 3 in here. What is the appeal process for those that may have gotten denied but believe that they shouldn't be?
Right. So there are a couple of things that you can do. First, you can email the disqualified email address. We are looking to do that. You can also apply to our ISARO office, our Employment Securities Appeals and Referees Office. Sorry, I know that's a long name, but ISARO, that's the typical appeals process. But we do know that the individual should also be applying for PUA.
Okay. What about those who are having problems with logging in? If they can't log in, they're having issues just getting into the system, what would you recommend?
So what I'm hoping, well, the target solution for that was the SQL Portal. So I'm going to ask you to try again. You may not get it on the first click because it still has a high volume. So try clicking a couple of times on that. Make sure you get in. But from what we're seeing and the load testing we're doing, the system is actually able to accept more claimants now than it was in the past, about twice the amount.
And is there a best time to file? Is there a time of day that you would recommend? I mean, I know there are like 500 people watching right now that all might file at the same time, but is there a time of day where you think that it's best to apply?
It seems to be better in the evenings and in the afternoons. The worst time to apply, I can tell you right now, the worst time to do anything is Sunday morning. Sunday morning is always bad. And the reason is everybody's trying to certify. So yesterday when we first started up on Sunday morning when we had this service up and running, we kind of watched what was happening. I think right before 9 o'clock, about 8,000 people were already in the queue trying to certify. So that's not the time that you want to do it.
Okay. All right. Well, Director Murakami, thank you so much. We got through a lot of questions there. Again, we appreciate you taking the time. We know that you are being called in and being asked to be in a lot of areas, but we appreciate you taking the time to speak directly to our readers and answer some of these questions. So thank you so much.
You're very welcome. Thank you.
Aloha.
Aloha.
We know you guys had a lot of questions. We got through as many as possible. And as we said, we went through and read all the ones from last week and tried to, condense them down for this week. We will again read these again. And then the next time we have him on, which I believe, Ryan, is next week. He's going to be joining us next Tuesday in a week. We will go through all of these and try to get you some more answers. We understand there's a lot of frustration and there are a lot of you out there. So we are doing our best to try to bring him the questions and get you as much information as possible. That is, as frustrated as I know so many people are, that is a lot of progress to go from 30% to 60% in just a week. And hopefully they make, he said, he's hoping that Wednesday, so that's tomorrow, they get through a glut of those claims as well.
Yeah, and again, we see a lot of the frustrations obviously coming through the comments, and again, we are trying our best to facilitate this information and get as much information out to all of you. Again, we would recommend that some of the questions that continue to be asked have been answered by the director in our, we've had him on 5 times now, and so if you go back and look at some of our previous episodes, some of the questions that are being addressed here and asked have already been answered in some of the others. So we encourage you to go back there because there's some key things that he mentions in some of the previous broadcasts that might help for some of you that are still trying to apply.
Also, you can head over to coronavirushawaii.com. Ryan has done a great job of actually clipping the questions into subjects, so you don't have to necessarily scrub through 30 minutes of live stream chat. You can just see your specific question there. So that, again, that's coronavirushawaii.com. It's a great website on all things COVID, but we've taken a lot of time to break the questions down into small videos as well.
That's right. Well, again, we'll be having him on next week, Tuesday, so we'll look forward to getting more questions answered, hopefully. In other news, again, as we continue to cover this COVID-19 pandemic, one of the things that we are also seeing is sort of hospitals beginning to resume some sort of normalcy in their own departments, with a lot of hospitals resuming those elective surgeries and reopening some of their clinics that are geared specifically for those with some of those health needs. We know that a lot of people actually had some of their procedures put on hold to deal with COVID. And I think another milestone happened yesterday when the Queens Medical Center actually took down their triage center that was set up to help to triage some of the patients coming in. But we're seeing a lot of more return to normalcy, if you will, especially with the hospitals and the medical side. And again, we expect to hear from the governor potentially today on that 7th emergency proclamation that will now make some of the more retail stores available and retail establishments back online, that we will see and get a listing of exactly what those look like.
Yeah, they're talking about what they call low contact retailers. And so we're looking forward to getting some more specific as to what those are. Restaurants don't make the cut of that list. We know that for sure. But there are other places that can do things sort of non-in-person, or you can pre-order on the web and then just go in person and pick things up. So we'll be looking forward to hearing the governor's announcement on that. Despite, non-elective medical procedure or elective medical procedures coming online and these retailers starting to come back online, projections say that the economy will not fully recover this year. There's an article all about that in today's paper. UHERO, that's the University of Hawaii Economic Research Organization, is projecting that there's going to be some long-term pain from COVID-19. Obviously, the folks who have tuned in for this particular broadcast, that's not really news to them.
That's right. I mean, a lot of people obviously suffering. And so UHERO, again, provides these projections based on the economy, based on unemployment, and taking in all these factors. And so it'd be interesting to see how that number changes as more businesses maybe become online. And I think a big contributing factor to that is tourism and when they will be allowed in. We are actually speaking with Lieutenant Governor Josh Green, who has sort of been on the front in terms of trying to establish a plan for allowing tourists back in. He'll be on the program on Thursday. So that's a question I know that many people want to ask. Besides news and connecting you with people, we also like to highlight some of the good things that are happening in our community.
Yeah, and for Hawaii restaurant workers, the Hawaii Food and Wine Festival has launched the Kokua Restaurant Workers. Oh, slide to the side there so you can see that great picture of Alan Wong. And so, like I was saying, Kokua Restaurant Workers Fund provides immediate relief for restaurant and bar workers who have been impacted by COVID-19. Starting on May 12th, people who have been laid off in this industry can apply for a $250 Visa gift card that can be used at local restaurants throughout the state. So that's a wonderful program. They're, creating these gift cards that they can then be reinvested in the restaurant economy. We love to see that there, and we herald them. They've already raised $68,000 in this effort. They're aiming to raise $250,000. If you are in a position to help, please do. They are looking for help at hawaiifoodandwinefestival.com, and the applications, if you'd like to qualify for one of those Visa gift cards, go live May 12th.
That's right. So a great way to support some of those who have lost their jobs. We know that a lot of restaurants and a lot of people had to let those people go as they close. So great to see Hawaii Food and Wine continue to step in to help and support our community. So we highlight them as our Hawaii hero of the day.
We thank you so much for being here today. Tomorrow we are switching gears. We're going to be talking to Dr. Melinda Ashton from Hawaii Pacific Health. It's our Ask the Doctor segment. We want to talk all about COVID-19, find out, we've heard a lot about things to look for if you worry that you have specific symptoms. So just asking her, about diagnosing this disease, symptoms in individuals, and talking more broadly about how this disease is affecting the medical community as well.
And specifically the antibody testing that is happening specifically at Hawaii Pacific Health with their employees. That testing could potentially be a way in which we allow people back into the state. So be interesting to see the update from her and sort of the reasoning behind that. So we encourage you to tune in right back here at 10:30 tomorrow for another conversation here on the platform of the Honolulu Star-Advertiser. Until then, we'll see you then. Aloha.